Atrial fibrillation is a sequel to mitral valvular insufficiency and other cardiac diseases. It is most often found in male dogs and is characterized by a rapid, irregular cardiac rate, usually over 180 per minute. Murmurs when present and the first and second heart sounds are variable in intensity because of the variable degree of ventricular filling. An important diagnostic clue is the presence of a pulse deficit, that is, when the auscultated heart rate is more rapid than the palpable peripheral pulse rate. Notice the irregular rate and variable intensity of heart sounds of a dog in atrial fibrillation. Ectopic contractions may arise from the atria or ventricles as single or multiple beats. The prevailing cardiac rhythm is disrupted by premature contractions. Because of incomplete ventricular filling and early contraction, the first heart sound occurs prematurely and is different from the normal sound. The second heart sound may be absent if ventricular pressures generated by the ectopic beat failed to open the aortic and pulmonic valves. Astute auscultation may differentiate atrial from ventricular premature systoles, but the electrocardiogram provides a more definitive diagnosis. In the next recording, 2 normal beats are followed by a premature ventricular contraction, giving the impression of a lub-dup rhythm. Bursts of atrial or ventricular tachycardia suggest an advanced cardiac lesion. Although the electrocardiogram provides definitive diagnostic data, the abnormal heart condition is first suspected during cardiac auscultation. A sudden, rapid burst of heartbeats of similar intensity, duration, and frequency is heard. The normal, slower rhythm is abolished during the burst of rapid heart sounds. The next sound demonstrates paroxysmal ventricular tachycardia interspersed with a slower, normal rhythm. Heart block, except that resulting from digitalis intoxication, is an infrequent condition in the dog. Incomplete heart block is suggested by the regular omission of a ventricular contraction. During the pause, a low-pitched atrial sound may be heard. In complete heart block, 2 independent rhythms occur. A louder but slower ventricular rate predominates, while a faster but lower frequency atrial rhythm is heard over the mitral valve area. Listen carefully for the lower frequency atrial sounds occurring between the louder but slower ventricular contractions of complete heart block.